You're seeing these words on the screen: ischemic stroke, hemorrhagic stroke, TIA. They're right there in the title. But let me ask you something simple. If I stopped the video right now and said, tell me the difference between those three, could you do it in plain English, without Google, and without guessing? For most people, the honest answer is no. You might have heard those words in a busy ER, on a rushed discharge summary, or in a shaky phone call about someone you love. In the moment, you nod, you sign, you say, okay, I understand. But inside, a different voice is saying, I know it was a stroke, but I'm not totally sure what kind it was or what that really means for us. Here's the part almost nobody says out loud. Stroke is one small word that hides very different problems happening inside your brain. A clot, a bleed, or a short-lived warning shot we call TIA. Different causes, different risks, sometimes different treatments. But the way it's usually explained to patients, it all gets thrown into one bucket called stroke, and you're left to nod along and hope for the best. This video is the opposite of that. It's literally what the title promises: a simple breakdown in plain English of ischemic stroke, hemorrhagic stroke, and TIA. What they actually are, how they're different, what they can look like after 40, and what you need to remember if it ever happens in front of you. You don't need to become a neurologist. You don't need to memorize Latin. You don't need to pass a test at the end. You just need a mental picture that finally makes sense. If you're over 40, stroke is not just a dramatic word from a medical TV show. It's something that can show up in your family, in your friend group, or even in your own chart at a routine checkup. You might see it on a scan report. You might hear it whispered in a hallway. They think it was hemorrhagic. They said it was just a TIA. If you can understand these three words at a basic human level, ischemic, hemorrhagic, and TIA, you will never hear the word stroke the same way again. You'll be calmer in the moment, you'll ask better questions, and you'll understand why one person goes home after a mini stroke while another is rushed straight to surgery. Let me ask you something, and be honest with yourself. When someone in your life had a stroke or a scare, did anyone clearly explain which type it was? Or did it all just get lumped together as one scary word, stroke? If your answer is no, nobody really explained it, you are not alone. That's exactly why we're here. By the way, if you appreciate clear, plain English explanations like this, and you're over 40 trying to make sense of stroke and brain health, consider subscribing to the channel. That's the best way to tell the algorithm and me, yes, more of this, less confusion, please. Now, in this video, we're going to build a simple picture you probably never got in the doctor's office. Not a lecture, not a textbook, a picture you can actually remember in an emergency. We're going to zoom out and treat your brain like a house with pipes. Sometimes the pipe gets clogged, sometimes it bursts, and sometimes it's blocked for a short time and then clears. Those three situations line up with ischemic stroke, hemorrhagic stroke, and TIA. Once you see that clearly, a lot of the scary medical language suddenly becomes much easier to handle. So let's build that picture of your brain like a house with pipes. Not a cartoon, not a joke, just a simple way to remember what's going on. Think of blood in your brain like water running through pipes in a home. Those pipes are your blood vessels. Their job is to deliver oxygen and nutrients to every tiny corner of your brain, 24 hours a day, no breaks. Now, three big things can go wrong with those pipes. First, a pipe can get clogged. Something blocks the inside of the vessel, and blood can't get through to the brain tissue past that point. That's an ischemic stroke. It's the clogged pipe version. Second, a pipe can burst and leak into the walls. The vessel itself breaks, and blood spills into or around the brain where it does not belong. That's a hemorrhagic stroke, a brain bleed. Third, a pipe can be blocked for a short time. The water stops for a bit, and then the clog moves and flow comes back. That's a TIA, transient ischemic attack. It's the same idea as a clot, but it clears on its own before permanent damage is seen. So, the simple picture is this: blocked, burst, or briefly blocked and cleared. 3 different events, all happening in the same very important organ, your brain. Let me pause and turn this back to you. Has anyone ever clearly told you which type of stroke someone you know had, or did it all just get thrown into one vague label called stroke? If you've lived through a hospital stay with a family member, you might remember hearing phrases like ischemic event, hemorrhagic transformation, or just a TI. But unless someone slowed down and translated that, it probably felt like a blur of words you were too tired and too scared to process. Here's the part that surprises many people over 40. Most strokes are ischemic. The clogged pipe version is the one doctors see most often in the emergency room. So that's where we'll start. Let's zoom in. An ischemic stroke is what happens when a clot or a chunk of plaque blocks a blood vessel that feeds part of your brain. Imagine a narrow pipe that's already lined with sticky buildup. One day, a clot gets stuck right in that tight spot. Suddenly, the brain cells beyond that blockage are starved of oxygen and nutrients. This type of stroke is strongly linked to those silent conditions that creep up on many of us after 40. High blood pressure, atrial fibrillation, that's an irregular heartbeat, diabetes, high cholesterol, smoking, and carrying extra weight around the middle. Individually, those might not feel urgent day to day. They don't always hurt. They fit easily into the "I'll deal with it later" box. But together, over time, they change the inside of those blood vessels and make clogs much more likely. When an ischemic stroke hits, the symptoms can show up very suddenly. You might see sudden weakness or numbness on one side of the body, trouble speaking or understanding what people are saying, one side of the face drooping when they try to smile, sudden trouble seeing out of one or both eyes, or a sudden loss of balance or coordination. Not every person has every symptom, but the key word is sudden. This is not, "I've had a mild headache for 3 days." It's, "Something just changed right now, and it's not normal for me." For ischemic strokes, you'll often hear the phrase, "time is brain." That's not just a slogan. Every minute that part of the brain stays without enough blood, more cells are at risk of dying. That's why in many cases, doctors race to give treatments that can dissolve the clot or physically remove it from the vessel. The goal is simple: restore blood flow as quickly and as safely as possible, so you save as much brain tissue and as much function as you can. Let me ask you a second question to sit with for a moment. When you think about your own blood pressure, blood sugar, cholesterol, and heart rhythm, do you treat them like minor numbers on a lab slip? Or do you see them as early clues about how likely your brain pipes are to clog later on? This isn't about blame. It's about seeing the connection. Once you understand that connection, the idea of working on your risk factors stops sounding like homework and starts sounding like protecting the part of you that remembers faces, names, stories, and moments. Now, I mentioned something important a minute ago. The treatments for a clot and a bleed can be very different, sometimes even opposite. For a clogged pipe, you may want to dissolve or remove the blockage. But for a burst pipe, adding powerful clot busters could actually make the situation worse. And that's exactly where we're going next. Now let's flip the picture. So far, we talked about the clogged pipe, ischemic stroke, the most common kind. But what happens when the problem isn't a blockage, it's a burst? That's where hemorrhagic stroke comes in, the burst pipe version. Here, a blood vessel in the brain actually breaks. Instead of blood quietly flowing through the vessel like it should, it leaks into or around the brain into spaces that were never meant to be filled with blood. That leaked blood does two big things at once. It irritates the brain tissue, and it can build pressure inside the skull, a closed space with very little room to expand. The result? Areas of the brain that control movement, language, vision, or consciousness can get squeezed, like a hand pressing down on delicate wiring. People with hemorrhagic strokes often look and feel different from the classic clot story. They may have a sudden, extremely severe headache, sometimes described as the worst headache of my life, nausea or vomiting, sudden loss of consciousness or near collapse, or the same kind of weakness, speech, and vision problems we talked about before, but with a more dramatic sudden crash. Long-term, uncontrolled high blood pressure is one of the biggest reasons these blood vessels become fragile and more likely to burst. Large American and international studies have shown this over and over. Keeping blood pressure under control dramatically reduces the risk of both ischemic and hemorrhagic stroke. The effect is especially strong for brain bleeds, where the vessel walls are under constant strain. Groups like the American Heart Association and American Stroke Association have been repeating this message for years because the data is consistent. Here's why this difference between a clot and a bleed really matters. For a clot and ischemic stroke, doctors may use strong medications to dissolve the blockage, or they may thread tiny tools through blood vessels to pull the clot out. For a bleed, a hemorrhagic stroke, those same clot-busting drugs could make the bleeding worse. So the question in the emergency room is urgent and very specific. Is this a clog or a rupture? That's why, when someone shows up with stroke symptoms, the medical team rushes them into a CT scan or MRI. The goal isn't just to confirm a stroke. The goal is to see what kind of stroke is happening, because the treatment strategy can be completely different. Sometimes the focus will be on reversing blood thinners, lowering blood pressure carefully, or even taking someone to surgery to relieve pressure or secure a weak vessel, like an aneurysm. Let me ask you a third question, and answer it honestly in your own mind. Knowing that a brain bleed and a blood clot need such different treatments, does it change how seriously you take routine blood pressure checks or conversations about blood thinners with your doctor? For a lot of people in their 40s, 50s, and 60s, the answer is, I knew it mattered, but I didn't realize it could be the difference between a clot we treat and a bleed we can't fully reverse. Now, we've talked about clogged pipes and burst pipes. There's one more scenario we have to tackle: TIA, transient ischemic attack, sometimes called a mini-stroke. The nickname mini-stroke is tricky. It sounds small, almost harmless. It can sound like a warning light on your car that you might ignore for a few weeks. But that's not the full story. A TIA happens when blood flow to part of the brain is blocked temporarily. It's the same mechanism as an ischemic stroke, but the blockage clears on its own before permanent damage shows up on scans. So the symptoms can look exactly the same as a full ischemic stroke. Face drooping on one side, arm weakness or heaviness, trouble speaking, slurred words or not making sense, sudden vision changes in one or both eyes, balance problems, or sudden dizziness. But here's the key difference. Those symptoms go away within minutes or hours. The cruel part is this: because the symptoms disappear, people desperately want to believe it was nothing, I just got a little dizzy, or my speech just got jumbled for a second, I was probably tired. In reality, a TIA is your brain saying, I just showed you what a stroke can look like in your body. You still have time to act, but not unlimited time. Research following thousands of patients has shown that the risk of a full-blown stroke is much higher in the days and weeks after a TIA, compared to the general population. That's why major stroke guidelines treat TIA as an emergency warning, not a harmless glitch. So, if symptoms appear and then fade, the rule is not good, it's over. The rule is, that was a serious warning shot. I need urgent medical evaluation to find out what caused it and what can be done to prevent the next event. Here's the part that should actually feel like a relief. In real life, you are not responsible for deciding, is this ischemic, hemorrhagic, or TIA? Your job is not to name it. Your job is to notice it and act. When sudden brain symptoms show up, you do not stop to play neurologist. You don't pull out your phone and search, is this a clot or a bleed? You treat it as a stroke until proven otherwise, and you get help fast. One simple way to remember the main warning signs is the phrase BEFAST. Groups like the American Stroke Association have pushed versions of this idea for years because the same core symptoms show up again and again in real patients. Here's how it breaks down. B. Balance. Sudden trouble walking, dizziness, or loss of balance or coordination. E. Eyes. Sudden trouble seeing out of one or both eyes. F. Face. One side of the face drooping when you try to smile. A. Arm. One arm weak, heavy, or drifting down when you lift both. S. Speech. Slurred speech, trouble finding words, or speech that doesn't make sense. T. Time. Time to call 911 immediately. Not time to wait and see. Not time to drive yourself and save the ambulance bill. Time to get emergency professionals involved. Whether the final diagnosis ends up being ischemic stroke, hemorrhagic stroke, or TIA, the rule for you in that moment is exactly the same. Sudden symptoms? BEFAST. Call 911. Do not drive yourself. Do not wait to see if it goes away. Let me ask you one last question to really anchor this. If these symptoms showed up in your own body or in someone sitting across from you, would you be more likely to say, I don't want to make a fuss? Or, I'm not a doctor, but I know this is not normal. We're calling 911 right now. That difference in reaction can literally change how much of you is still there on the other side of this event. Now, outside of emergencies, there's another part of this story that often gets forgotten. What happens after a stroke or TIA, or even before anything happens at all? If you or someone you love has had a stroke or a TIA, the work isn't just recovery. It's also investigation. This is where your healthcare team looks deeper. What's happening with your blood pressure, your blood sugar and A1C, your cholesterol, your heart rhythm, any atrial fibrillation? How's your sleep, your weight, your activity level? Large long-term studies in the US and around the world have shown that managing these pieces can dramatically lower the risk of a first stroke and the risk of a second stroke after the first one. Blood pressure, diabetes, and atrial fibrillation are especially important here. So in the calmer days outside the ER, this is where you sit down with your doctor and ask very direct questions like, based on my blood pressure, my blood sugar, my cholesterol, my heart rhythm, and my family history, which type of stroke are you most worried about for me? And what can we do now before anything happens? That kind of conversation is not overreacting. It's you being the adult in the room about your own brain. Now, a very important note before we close. I am not a doctor. This video is general education, not personal medical advice for your specific situation. I'm not examining you, I'm not looking at your scans, and I am not replacing your own healthcare team. In any emergency, always follow the instructions of your local emergency services and the doctors and nurses who are directly taking care of you. If you have questions about your own stroke risk or past events you're still confused about, please bring those questions to a qualified medical professional who knows your history. If this video helped make things clearer, you don't have to share personal details. You can just comment something simple like, "I understand the difference now," or "I won't ignore sudden symptoms." That one sentence might be the quiet nudge someone else needs to finally take this seriously. And if you want more plain English videos about stroke and brain health after 40, go ahead and subscribe and stay with us. We'll keep translating medical language into something you can actually use in real life, not just in theory. You are not too young for this. You are exactly on time as long as you're willing to learn, notice, and act when it matters. Your brain holds your stories, your memories, your relationships. Protecting it is not overreacting. It is self-respect.